Okay, my last video was about nourishment. This one is kind of related. It's about something that happened. You know, it probably was almost as prevalent when I would do investigations as the nourishment or malnutrition. It has to do with dehydration. That happens a lot. People just going without liquids enough and it really affects them. And, you know, all of a sudden it gets too serious and they got to go to the hospital, you know. So, you know, how do you ensure your loved one gets enough liquids in their diet that they're not going to suffer any negative consequences? Well, there's two risk factors. The first groups that tend to have dehydration are those that don't access or cannot access either physically or intellectually liquids, you know. So they may be in their room, but they can't reach over and get that water. They can't connect that water is what they need, you know. So for those folks, you have to remind staff when you go in there. For those folks, you have to remind staff, hey, would you mind offering my mom and dad, would you give them a little bit of water when you come in the morning or every time you come in? Could you just offer them a little drink? I mean, in the past, I mean, that would be kind of common. We'd always ask that as surveyors, but we kind of got away from doing that, but it's still a concern. It's kind of like we expect them to get all their liquids at mealtime. And generally, if they are getting all their liquids at mealtime, that's enough. But generally, it's good to offer at all times because sometimes they aren't always getting their liquids at meal times. You know what I mean? And back to preferences again. You know, let them know what their drinking preferences are. Maybe they have certain juices or liquids they like. Maybe if the facility can provide or doesn't provide that, you can bring that in yourself and offer that and make that available. And then remind staff that they should be doing that. You know, I know that, you know, you're probably paying a lot for that nursing home and they're getting a lot, but sometimes I hate to say it, but sometimes you got to be the one that educates staff about what your loved one needs. I know that's bad, but that sometimes is the reality. You put reminders, or, you know, what I would do if I had a loved one in a nursing home, I'd put all the little things, I'd write them down on the inside of the closet, and I'd write down, hey, please remember to do this. My parent likes to drink V8. I brought V8 cans in. Just pour it in a cup and offer it to them. Every time you come in, just offer them V8. Or they like to wear this blouse, or whatever that specific thing is for your loved one. Just jot it down, and they'll probably appreciate it, because a lot of times you get these new nurse aides that are coming from a different hall. They don't know your loved one's preferences. So spell it out to them, talk to them about it, maybe remind them about it, post reminders in the room if they're not too personal, anything like that, just to help reinforce what your loved one needs would be good to do it. Now the other folks, the other group that tends to get dehydration are folks who have infections, right? So if they call you about your loved one maybe having a urinary tract infection, or even just, you know, a high fever or a flu or a cold or something like that, well, they need to make sure to get them plenty of liquids, because often, you know, the body is using a lot of liquids and it gets dehydrated. So extra liquids have to be offered. So call them, and when they tell you about that, say, hey, what are you doing to make sure they get enough liquids? And start suggesting stuff if you have to. You know, popsicles, drinks between meals, snacks, anything. And then, another thing, if they have an infection, they also tend to be, they can be vulnerable to delirium. And what's going to happen then is they may elope or try to get out of the facility. So you want to also have that discussion with the director of nursing. Hey, you know, my loved one's got a UTI. They're not on a locked unit right now, so I'm afraid they might, you know, get out of the building. Is there anything you can do to kind of keep them safe from, you know, that possibility, because they're in this confused state for a little bit? And then, you know, and then hopefully she'll have some things she can offer. You know, they usually have these things called wander guards, where they're like little bracelets they can put on residents that'll make a door alarm if you go near it or exit out of it. If they don't have anything at all, you know, they sell these $40 little GPS bracelets. you can tie into your cell phone, because the longer somebody is outside of a nursing home, having eloped, the more dangerous it is, the more likely it is they're going to get injured or died. So they're like $40 for these things. Get one of those and have your loved one wear it around their neck or wherever when they're having this dehydration or delirium, or they got a UTI, and just, you won't have to worry about that. They call you, your loved one got out of the facility, boom, you'll identify right where they're at. It's like the last ability we lose, and it's one of the first abilities we have when we're born. That's that ability to suckle, right? And if you have somebody that can't access fluids and may be a little confused, you can set up a device on their wheelchair or wherever they sit so that you have an extension arm, and in that extension arm is a little cup with a little straw, and maybe their favorite drink is in there. And you know what? They may not realize a lot, but they realize what that straw is, and they'll go over there and they'll sip on that, and they'll taste that flavor they like, and yeah, they'll drink a little bit more of it because it's right there. It's accessible. All they got to do is turn their neck, keep drinking. Now, if you can't make that device, there's a couple of places that sell it. I think Snake Clamp was one. You can go on the internet and look and see those devices. And if your loved one is having difficulty accessing fluids because of cognition or because of just physical lack of ability, I would highly recommend doing something like that and making sure staff put that on there and fill it up with the liquid you're telling them. And hopefully that'll avoid any issues. And God, if they're even doing weight loss, you could put like a supplement in there. That'd be great for them. But that's my suggestion on that. So, well, hopefully you found this helpful. If so, give me a thumbs up so other people can see it, and share it with others that might benefit. And if you want to learn more, please just go to nursinghomerisk.com. That's nursinghomerisk.com. And I look forward to seeing you on the next one.